Dr. Cole, let's start with some basics. What is bispecific antibody therapy and who is it right for?
Yeah, when for in cancer medicine, kind of to describe bispecific antibodies, we need to really start with what a T cell is, because in cancer medicine, the really all of the bispecific antibodies engage T cells. So T cells are a cell that's in our bodies, which help destroy cancer cells naturally. And so the T cells, when we have any mutations in any of the cells in our body, and it starts to become cancerous, the T cells come in and wipe it out before it even gets started. And so part of the reason that people get cancer is that those cancer cells find a way to evade the T cells. And usually what they do is they hide. They're able to masquerade as normal cells, and the T cells that should destroy them just slide right over them or check their ID and say, well, you're okay, and let them go. Then the cancer cells can grow. And so what the bispecific antibodies do is that a regular antibody is shaped like a Y, and usually both ends are really sticky to stick to anything, usually bacteria, viruses. And that's the antibody is the way our immune system fights infection. And antibodies are sticky. They got two sticky ends. What they're able to do in the laboratory is make one of the sticky ends to an antibody, not produced by people, but produced in a laboratory. One sticky end is specific to the T cell. One sticky end is specific to the cancer cell. And when you give this drug, it brings the T cells that have been ignoring the cancer right up against the cancer cells. And so all of a sudden, the T cells that destroy cancer that have been ignoring the cancer cells are suddenly made aware of the cancer cells. And as soon as they see those cancer cells, they begin to kill the cancer cells. And so it brings the cancer hunting T cells together with the cancer cell so the T cells can destroy the cancer. And who is it right for? Most, if not all, of the bispecific antibodies that are approved now are for people that have cancer that's advanced, that has failed several therapies. And that's the usual place where new drugs go, is for the people who are most in need, the people who have exhausted a lot of other options. And so really it's right for anyone who has advanced cancer, who needs new therapeutic options.
How is this therapy administered and what is the frequency?
Yep. So usually, for most bispecific antibodies, they're administered subcutaneously under the skin, and some are administered IV. Some are administered over long periods of time, where people go home with infusion packs and they get it over several days. And some of them are given once a week or every 2 weeks. And so it really depends on what type of tumor is what the bispecific is being used for and which tumor it's directed towards.